Welcome to this week's edition of Ask an MS Expert. I'm Jon Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your questions and comments on Facebook, YouTube, or Twitch. MS navigators are online throughout today's program, answering those questions and connecting you to resources. Before we get started, I want to acknowledge and thank today's contributing national sponsors, ANI Pharmaceuticals and Novartis. Support from MS community partners helps the National MS Society reach its goal of providing up-to-date information and support through programs like Ask an MS Expert. Establishing and following a treatment plan with your healthcare provider is the very best strategy for managing multiple sclerosis. Medications are used in MS to modify the disease course, treat relapses, and manage symptoms. Today, we're talking with pharmacist Ross Tingen about the importance of MS medications and how to work with your doctor to find the best medications for you. Ross is the clinical pharmacy specialist in multiple sclerosis neuroimmunology at VCU Health in Richmond, Virginia. Ross, welcome and thanks for joining us today.
Thank you so much for having me.
Multiple studies have produced evidence that shows early and ongoing treatment with disease-modifying therapies, also known as DMTs, has long-term benefits. But sometimes the reason for being on a DMT isn't entirely clear. So I'm hoping you'll start us off by explaining what the goal of disease-modifying therapies is and why they're so important.
That's a great question. So essentially, a disease-modifying therapy is used to modify the disease in a very simple way. Most patients, over 85% of patients, are diagnosed with relapsing disease, and the goal of those therapies are to prevent future relapses, and that could be both clinically new symptoms or changes on the MRI. Now, they don't necessarily fix the previous scars or previous damage that was caused earlier in the disease. So the whole goal of those therapies is really to decrease the risk of future relapse and decrease the risk of progression.
We heard from Andrea, who tells us she was recently diagnosed with MS, and Andrea's MS specialist recommended she start a DMT as soon as possible. Why is treatment early on so important?
So the earlier we treat, the less likely you are to have additional relapses for a longer period of time. We know that patients that are diagnosed with multiple sclerosis, this is a lifelong disease. So the earlier that we can prevent those relapses, the more we are able to prevent disability.
4 disease courses have been identified in MS. There's clinically isolated syndrome, relapsing-remitting MS, secondary progressive MS, and primary progressive MS. Do disease-modifying therapies treat all 4 subtypes of MS?
So it's a really good question in regards to categorization. So all disease-modifying therapies are, approved to treat what we call relapsing diseases, or relapsing forms. And so that could be clinically isolated syndrome, what we call active secondary progressive MS, and relapsing multiple sclerosis. There's only one disease-modifying therapy currently FDA approved for the treatment of primary progressive multiple sclerosis.
There are more than 20 DMTs approved by the FDA, and each one carries with it different side effects and risks. With all these options, choosing a disease-modifying therapy can feel overwhelming. How can people living with MS go about narrowing down their choices?
So it's really important to work with your neurologist and their neurology team. There are greater than 20, there are some generics available, and the landscape has gotten quite complicated in regards to side effects. And so it's really important to not only look and listen to the neurologist when they're explaining medications, but also when you're doing your own research to go to really qualified resources such as the National MS Society's website. They're going to have concise, narrow, non-biased information around each drug. But it is going to ultimately come down to both your risk tolerance as a patient and what you're willing to treat with or be treated with, and then what your neurologist is willing to treat with, given your patient specific factors that come down to it.
All medications have side effects, and we don't have time to go through each DMT, but can you talk about some of the monitoring or safety tests that are done to mitigate risks and limit those side effects?
So it's very common to need baseline, what we call blood work, so lab testing. And that's going to be for almost every disease modifying therapy. It's very common to get your blood count so we know what your immune system looks like. And we want to also know how your organs are functioning. And so that is a very common test. Now, from there, it does vary depending on which medication you're going on. You'll also find that certain medications also require that we look at urinalysis to monitor your kidney function. Additionally, they will be doing MRIs to see what your baseline MRI looks like and what that looks like in the future to know if there's been radiographic or MRI changes. Those are all extremely variable depending on the disease modifying therapy. And with there being 20 of them, as you can imagine, it can get quite complicated. So when you're making a decision to start therapy, that is something that should also come into consideration, is the amount of monitoring that may be required.
Paul tells us that he's been on his DMT for 6 months, and he says he doesn't feel any different now than he did before he started his DMT. So how does someone know if their DMT is working for them? And if their DMT isn't working, what are their options?
So our ultimate goal is that Paul be stable. And so there may not be any changes. Now, to be successful or have a really good disease modifying therapy for you, you're going to want no new clinical symptoms or clinical changes. So nothing new. And then you'll also want to make sure that your MRIs are monitored and there's no changes on your MRI. So again, there is very often that patients aren't going to notice anything specifically different or improved, and that's okay. That is actually what we're looking for. We don't want anything to worsen. Now, if there were to be MRI progression, so changes on the brain MRI, or the patient have a clinical relapse or not tolerate drug, again, there are 20 drugs on the market. And so there are a lot of other options if that drug doesn't work for you. It's very important to know that each person living with MS is different from every other patient living with MS. And so those symptoms and that experience is going to be different than anyone else's.
We heard from Lindsay, and Lindsay's wondering whether an injectable DMT is stronger than an oral medication.
So that is great. I think the answer has changed over time and will continue to change over time. But no, we have injectable therapies that are what we consider higher efficacy. We have injectable therapies that would be kind of considered lower efficacy, but lower risk. The same thing with oral therapies. They also kind of go across the board. And so it is important to have that conversation when you're deciding on therapy if you are risk adverse or intolerant to getting an injection, because there are high efficacy oral options. There are high efficacy injectable options as well. So it's not as a direct question or direct answer, but.
Well, we heard from Angela. Angela wrote in to say that she's been on the same disease-modifying therapy for the past 8 years. She hasn't experienced any relapses. However, she is getting tired of giving herself injections, and she's considering switching to an oral medication. But Angela worries about rocking the boat by making a change since she's doing so well. What advice do you have for Angela?
So my advice would be to, again, bring it back to your neurology team and discuss the risks and benefits of changing therapy. There are a lot of different therapies out there, but we do know that if you can't tolerate treatment or you're missing multiple doses because you're having what we call injection fatigue, that's not going to work as best for you. So if you do feel like you are having injection fatigue, are tired of doing injections, it is really a great time to have a conversation with your neurologist around the risks and benefits for you specifically on changing therapy, because we do have other options out there.
How long does someone need to stay on a DMT? Is there ever a safe time to stop?
So, as we grow in age, our immune system does change. And there are certain situations where your neurologist may discuss with you stopping disease modifying therapy. There is some literature looking over the age of 55 or 65 if you've been stable to stop therapy, but it is again going to be very personal decision and very specific to your disease process. As of now, we know that multiple sclerosis is a lifelong disease, and so we would indicate a need for lifelong treatment.
Research to identify new disease-modifying therapies is ongoing. Can you give us a bit of a preview of what's on the horizon?
So most readily, the kind of next big option is something called a BTK inhibitor. It is going to be an oral therapy. We have a few years out from that. There'll be a few of them probably coming to the market, and they will be immunosuppressive, similar to some of our other treatments that are out there. That's kind of the hot topic currently, but those will probably be the next ones coming to market, aside from the new generics that are being approved.
Clinical trials are underway right now to evaluate whether early and aggressive treatment of MS with DMTs is more effective in the long term than gradual escalation to stronger treatments over time. Ross, can you explain these two different approaches to treatment, using a powerful or high efficacy therapy from the onset, which is called induction therapy, or starting with a less powerful therapy and ramping up to a more powerful approach if relapses or other signs of disease activity continue? And that's called escalation therapy.
Yeah, it's great. There are two large clinical trials going on trying to answer that exact question. Historically, back since 1993, we didn't have FDA approved drugs really for the treatment of multiple sclerosis. And now we have over 20. They all work differently. They all have, there's a class that may be a little bit lower efficacy, but they might have a better safety profile. And in many cases they do. As we increase the efficacy, many drugs become immunosuppressive. And that means your immune system will actually change and shift and be suppressed or lowered with those drugs, which along with that comes increased risk of infection and other things. So there are two kind of thoughts right now, which we're looking at. One is escalation. And what that is putting patients on lower risk, but probably a little bit lower efficacy treatments. Now, it's important to know that those drugs have been used for a very long time. They are efficacious. We do have patients that have been stable on those drugs for decades. So it's not that they're giving you the less, important drug, but it's different because depending on your family planning, your blood work, how your MRI looks, what you and your neurologist are most comfortable with, that might be the best thing for you. And you might be able to stay on that lower efficacy, lower risk drug for a long period of time and be stable. And then as you change, and if you are someone who has a relapse, there are a lot of other options out there to escalate to. On the other hand, what is being considered this induction therapy is using high efficacy treatment off the bat. And that is, that thought process is, hit them hard, hit them early to prevent any additional relapses down the road. With that, though, you are balancing your risk. And so whether that be risk of infection, risk of blood counts changing, thyroid disease. And so there's a lot of other risks to be weighed there. And each person really is going to end up making a decision that is best for them, but it is two different ways of thinking. Now, one may sound better to you than another, and another person from MS, with MS might also have the opposing opinion, but it's important to know that that's really, we don't know the correct answer right now. And even at the end of the day, it's going to be patient specific because, again, one of the challenges of multiple sclerosis is no person presents exactly the same. It is extremely variable, and each person is a little bit different.
Disease-modifying medications are designed for long-term use, as you said, and it's important that people take their medication as prescribed in order for that medication to work correctly. But many people stop their medication for a variety of reasons. Perhaps they aren't feeling any better. They're experiencing bad side effects. They sometimes forget to take their medication, or they can't get off work to go for that infusion appointment, or perhaps they can't afford their medication. Why is adhering to your medication schedule so important? And what are the risks if you don't?
So it is really important, I'll say off the bat, to pick a drug that works for you. Because if it is a drug that doesn't work for your lifestyle, whether it be because of your work schedule, you're busy with children, you have 1,000 things going on, if you pick a medication that you're hesitant of taking or you have a reaction to, it's like a less likelihood that you'll be able to become and stay adherent or be able to take your medication. We know that those drugs work in a very specific way, but if we're not able to take those medications consecutively or consistently per se, we know they're not going to work. And if we know they're not going to work, you are going to be at an increased risk of relapse, both clinical and changes on your MRI. So adherence is very important.
Speaking of which, Jamal told us that he often forgets to take the morning dose of his DMT, but he hasn't told his doctor because he doesn't want to let her down. What advice would you give someone who sometimes forgets to take a dose of their oral medication?
This is pretty common, a lot more common than I think people that are experiencing it believe. Taking medications more than once a day can be difficult. Taking medications in general with the general life going on. Now, it is important to tell your neurologist and your neurology team if you're missing doses, because we don't want to assume the drug has failed if something happens, if you've been unable to take it. There are a lot of different techniques to go about that, helping to remember your treatment. But your neurologist, there are a lot of other options. So if the drug you're on, you are unable to stay adherent to, it is okay to talk to your neurologist and say, this isn't working out. I need to go on something that is better for my lifestyle and will improve my adherence or my ability to take that medication.
What about people who have other comorbid health conditions or risk factors like type 2 diabetes or high blood pressure, other cardiovascular risk factors? Is this something that should be considered in their MS therapy decision?
Yes, it's very important to be open and honest about anything else going on in your life. If there are certain medications that we would want to avoid, if you do have a cardiovascular history or diabetes, it also is really important when it comes to you maintaining those drugs and the drugs that may come to follow for other disease states. So it's very important to work with your neurologist on your current disease, other diseases, and so that you can go on the best therapy for you.
Well, in addition to treating the disease and managing relapses, some day-to-day symptoms of MS can also be treated with medications. What are some of the MS symptoms that are treatable with medication?
So that is great. There are a lot of what we call hidden symptoms with multiple sclerosis. And, with multiple sclerosis being what we call a central nervous system disease with the brain and the spinal cord, symptoms can be, again, variable patient to patient, but can be multi-organ focused. Very commonly, or some of the most common symptoms are going to be spasticity or muscle spasms or tightness. Neuropathic pain or tingling, burning pain can happen. Fatigue is very common and something that we work with our colleagues in OT with in occupational therapy. Bladder dysfunction and headache are also very common, and all of them can be treated. And so it's important to not assume that your symptom or something that's going on isn't your MS. Your neurologist can help you kind of figure out if there's something else we can do for you to make you and your day-to-day a little bit better.
And how do you know when it's time to start using a medication to treat a symptom And is it safe to take these medications if you're already on a DMT?
So the good news is almost every symptomatic medication I use and most other teams use don't interact with your disease modifying therapies. So that's a really good kind of general knowledge to know. Now, when to decide to medically treat your symptoms is going to be a pretty personal decision. But I think having an open and honest conversation about what you should expect when treating your symptoms. So what is the end goal? Are you able to tolerate the medications that they want to prescribe? And, really how are you going to monitor that? How are you going to judge success with your treatment? Is it going to be that you don't have to go to the bathroom as often, or that your spasticity has improved? And having that conversation sets the expectations up a little bit better of starting a new symptomatic medication.
Well, you've shared some great information about a subject that I know can feel overwhelming and confusing to an awful lot of people. What would you say are the top 3 takeaways that you'd like our viewers to remember?
Yes. So number one, I would say that we know that disease modifying therapy prevents relapses, both clinical and radiographic. And so it's very important to understand the use of that medication. So when you're looking at other drugs and wanting to start therapy, starting disease modifying therapy is the one thing that we know could give you the chance to prevent relapses. The second is that no patient with MS is the same. So what your decision is for your body with your neurologist and your neuro team may be different than someone else that may or may not look like you with multiple sclerosis. And so doing our best not to compare ourselves to others, I think, is very important. So you can set your own expectations and be successful. And then the third is having an open and honest conversation in relationship with your neurologist and your entire neuro team. These people will be with you throughout your journey with this disease, and they are there to support you. And so whether it be a new symptom or a previous symptom that you maybe just didn't want to talk about yet, make sure that you have a relationship with your neurologist and your neuro team to be able to communicate that well, and if there are changes.
Well, thank you for sharing your expertise with us today, Ross. Let's continue answering more questions from our viewers. We heard from Jane, who wrote in and said her doctor doesn't usually include her in treatment decisions. She wants to know how she can advocate for herself to be a part of that conversation.
Yes, so that is, something that is difficult because you go in there and you want the neurologist and the physician and the treatment team to have that authority because of their knowledge, but it is very important to also kind of state your case. This is your healthcare. This is your disease, and you are the one that's ultimately going to be living with the decisions that are made in that clinic appointment or in that space by that team. So, a couple ways to really advocate for yourself are just speaking up. If they I always say, like, if you don't know or something seems confusing, it's really hard to get lost when you have a bunch of medical professionals start speaking medical jargon and nobody knows what's going on. So make them stop. Say, I'm not sure what you're talking about. Or if you have a whole team of like learners and they're talking and you're not sure what they're talking about, but they know it's about you, tell them to stop and explain what's going on. And it's probably a little uncomfortable to raise your hand and be like, whoa, please tell me again what you mean. But if you can't have that conversation or feel like you have that open kind of communication, you really want to find a team that works best for you.
We heard from Kim, who's considering having children in the next couple of years and wants to know if this is something she should tell her MS specialist.
Yes, one of the most amazing things that your MS specialist can help you do is help you do the best you can with your disease around family planning. There are options for changing your disease modifying therapy or planning around your pregnancy to not only help you be successful in your family planning, but also keep your brain and spinal cord, your disease stable. And so it's a really good conversation to have. And it should be addressed at every other visit. And so if your opinion changes on your family planning, always bring that up so that you can all work together to do it safely.
Tyson wants to know how long it takes for a DMT to start working.
So that's a great question, and it really depends on the disease modifying therapy and how the disease modifying therapy works. Very frequently, we get MRIs twice a year in some situations. The National MS Society and others recommend once a year. But the way the drug works is ultimately how we decide when we would expect it to be effective. And so it is a harder question to answer in regards to when is it effective.
I think you've started answering this next question a few times in our conversation today. We heard from Alex, who said side effects from his MS medication make him feel worse than MS itself. Wants to know if he should tell his doctor and consider switching to a different therapy.
I would definitely tell your doctor. There are certain ways to help mitigate or decrease side effects. It might be, are you taking the medication with food or not with food, depending on the drug? Are there additional, medications you could take on the day of if you're having reactions? And so it's a really good conversation to have. And that decision could be keep you on what you are currently on and maybe doing some modifications to make it more tolerable and decrease side effects. Or it might be to, shift and pivot and change to something that is better for you and better to be tolerated.
Well, I want to thank everyone who submitted some great questions, and thank you for being with us today, Ross.
Thank you so much.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For further information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups. You'll find ways for you to get involved, and you'll hear about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Ross Tingen for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to please fill it out. On behalf of Ross Tingen and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.